But thanks everyone for joining. My name's Andrew Schwartz. I work at the Center for Earth Ethics, and we've been doing this webinar series with our friends at the Climate Reality Project, the Climate Speakers Network in particular, for about a year now. These webinars are meant to try to help faith communities better understand climate change from a variety of angles. Coincidentally enough, we were going to do one on climate change and health before the coronavirus hit, and now it's here, so this has changed a little bit. But thanks for being here. Special thanks to Marium, who I'll introduce in a second, for sharing this. But I want to send it over to Laura Carter from Climate Reality Project to introduce yourself and say a few words.
Sure. Hi, everyone. Thank you for joining us today. I know even through social isolation, which most of us are practicing, there are several interesting documentaries and crime specials and movies on Netflix, Hulu, Disney Plus, Amazon. There's a whole plethora. So I appreciate you giving us an hour of your time when you could be brushing up on some good Netflix, or what I should be doing, organizing one of the closets in my home. But I'm Laura Carter. I work for the Climate Speakers Network. We are a special project of the Climate Reality Project. If you are not familiar with the Climate Reality Project, by former Vice President Al Gore, 2006, and they hold large trainings all over the world to take a deep dive into climate and environmental issues. And Al Gore gives this famous 2-hour presentation, and we have experts from around the world. With the Climate Speakers Network, we are in similar fashion, in which we go to communities all over the U.S. and different pockets internationally, and we hold trainings where it's a deeper dive into climate and environmental issues in communities that often can't make it to our big trainings. We come to them, we spend some time, dive into their specific issues, and do our best to work with communities to get them up and moving for climate and environmental action. So that's the best way to put it. Thank you all for being here, and please, feel free to throw some questions in the chat log so we can make sure we utilize the most of our time and our wonderful speaker.
Very cool. Well, yeah. Well, thank you, Laura, and like she said, thanks everyone for being here at this time. I want to introduce now and get things kicked off Dr. Marium Husain. We got to know each other during our Food and Faith conference that we hosted at Methodist Theological School in Ohio last year. And Marium is at the Ohio State James Comprehensive Cancer Center, and she is also the vice president of AMANA, which stands for the Islamic Medical Association of North America. She's awesome and amazing and has put together this presentation. So I will hand it off to you. And just so you know, as a little point of order, if you have any questions, please put them in the chat. Laura and I will help moderate at the end. There will be time for Q&A once Marium's done with her presentation. Please do keep yourselves on mute. And if you have any questions, direct message me over the chat. All right, Marium, over to you.
All right, thank you guys so much for that introduction. Can everyone hear me okay? Just to make sure. You're good. Perfect. All right. Well, yeah, again, thank you so much for that introduction, Andrew and Laura. I just wanted to say that I'm really grateful to have this opportunity to speak about this topic. So really big shout out to Center for Earth Ethics and Climate Reality Project. If you guys aren't familiar, please familiarize yourself with them, especially while we're all in quarantine. So I have about 20 minutes for this talk. And so Andrew helped a lot with, trying to figure out what can be some really high value points for you guys. So if there's any questions, if there's anything that I kind of went over a little quickly just for the sake of time, please feel free to ask. If it's about coronavirus, if it's about climate change, about Islam, about any of it, more than happy to answer anything. So the title of this talk is Healthcare in the Balance. And so I think this is probably maybe the second time, maybe in my lifetime at least, where healthcare was such a debated topic. Obviously the first being the Affordable Care Act. But before I go into that a little bit more, I just want to center this back to what it's really about. So these are 4 people, real people, that are in the news story right now. an emergency physician, a nurse, a principal, and a firefighter. And a lot of times, we can get into, I can talk about, the specifics of microbiology and the science behind climate change, but a lot of times people get lost in the process. And sometimes it's hard to look at the whole world and conceptualize that, but sometimes you can conceptualize one person. And maybe people like this in your own society. So you can't, Andrea had said that we were supposed to talk about climate change, but the world changed a lot in the last 2-3 weeks. And so if not further than that, but you can't go any further without talking about the coronavirus. So, sorry, let me do that real quick. But before we get into that, one thing I really want to delve into and really drive home to you guys is this idea behind science and myth. And I can't take credit for this quote or this picture, but this is to Nick DePalma over at Space Time Labs. The link to his website is there, so please check them out as well too. They're a science communication agency, but basically there's a whole bunch. There's as me as a scientist and as me as a person of faith. So I'm a Muslim, and I don't have a problem connecting the two, but what I realize is that it's a big problem for a lot of people, whether it's political or not. And so, just talking about this as well too. So with Jaws, right? People didn't go to the beach for a long time, apparently, after it first came out. But it was a completely fake shark. But when you actually have actual facts and actual reality about, let's say, the flu or the climate or even coronavirus, there are a lot of myths out there. A lot of people question, reality and question facts. And then it makes you question what is reality, what are facts. So just something, again, kind of underlying this conversation. The reason why I wanted to bring this up too is because myth, sometimes it's fun, right, to have superstitions or to have these memes that make fun about the coronavirus, things like that. But when does it actually become real for everyone? And when does it become dangerous? So I don't want to get into the vaccine debate because that's, in and of itself, its own thing. And but the thing that I did want to point out in the first, these two are news headlines recently, that Tamiflu is not a vaccine. It's an antiviral medication. The same type of category of antiviral medications that the FDA and the CDC are trying to make right now for the coronavirus. And so somehow Tamiflu, this antiviral, got associated with vaccines, and a 4-year-old boy passed away because he did not receive it because of that association. Scientifically, there's no relationship, but unfortunately, that became a reality for this child and his family. And then most recently with the coronavirus is, if people haven't already heard about an Arizona guy who was using hydroxychloroquine, which is one of the drugs now in mainstream conversation, for his fish to prevent parasitic disease with his fish. And he ended up ingesting it after hearing a press conference, and he died because of it. And his wife also did as well, and she's in critical condition, at least that we know of right now. So this is just to belabor the point that science is about facts, and facts are always important. And that's what we're going to focus on this topic. A lot of what I'm going to say is not my personal opinions, but actual facts. And if I do have a personal opinion about something, I will make sure to mention that. So for those who may not be familiar, Johns Hopkins has done an amazing job outlining the incidence of coronavirus cases, the amount of deaths, the amount of people that have recovered throughout all this. And they have a really great track map. So you just have to Google John. This is why this picture, almost 500,000 cases, almost 22,000 people dying. Again, when it's the whole world, it's hard to conceptualize all of that, but closer to home, at least the entire United States, this was as of this morning at 11 o'clock, 11:10 a.m. And so as the press conference was stating yesterday that, now, or I believe it was 2 days ago, that now we're the third highest number of cases in the world. We now have 1,000 deaths since this started. And so some people are starting to recover, which is really good. But like Dr. Burks, who's heading that task force, was saying, we're still on that upswing of this pandemic. it's not ending, at least right now, and we're still going to have more cases and unfortunately more deaths. So this is just to put it into reality how widespread this actually is. And kudos to Johns Hopkins for helping us to visualize this. So basically, what it comes down to, quick things about the virus. So coronaviruses have existed for a long time. And the most recent ones, probably in my lifetime at least, that we know a lot about are SARS, when you think about 2003 with China, and the Middle Eastern respiratory virus, which, as you can guess, was kind of more prominent in the Middle East part of the world. So those are the two common things. So basically the thing is that this virus is in the same family as those other viruses, but it's not the same thing. So I just want people to make sure that they're not saying this is just SARS 2.0 or something like that. It's something completely different. It's also different than the flu. It is not, some people are like, this is just a flu-like virus. It can have similar symptoms, but it is not the flu. And as of right now, the thing, again, that this is all about facts and everything, is that there's this thing in epidemiology where people follow case fatality rate. And that basically means is that the amount of people who are infected with the virus, so not everyone, the amount who are infected, and how many of those people die. Right? Because we know at least that thankfully some people recover from this virus, a lot of people recover from the flu. So the case fatality rate of the flu is 0.1%. So 1 in 1,000 people will die from the flu. And about 22,000 people died of the flu last year. So that's putting that perspective. With this virus right now, the amount of cases that we know of, the case fatality rate, depending on different countries, or in the sense of the data we're getting from different countries, is 3 to 6%. So that means 30 to 60 in 1,000 people compared to 1. So this is a very serious virus. It is a deadly virus. People are dying, as I just showed you in the last slide. The symptoms can be, not everyone has to have all of these symptoms, but these symptoms are cough, fever. It's nice if you have a fever, because then we know some people don't have a fever, so then they end up going through having the virus and we don't know. Diarrhea can sometimes be, GI symptoms can sometimes be the symptom as well. One thing that I really want people to know as well too, that was coming out of China, is that a loss of smell. So if for some random reason you can't smell things or taste things, that's something to also talk to your doctor about too, because they've been seeing that in some asymptomatic patients as well in China. And I believe in Italy as well, they had mentioned that. So cough, fever, somewhat, not as common, but diarrhea and maybe a loss of smell or taste. The main point of, if you forget everything I say this entire webinar, is flatten the curve. That this is literally the only thing right now that we can do as a society and as individuals to help prevent this virus from becoming worse. And what this graph basically shows is that if we, in the red, that if we don't do any measures and the cutoff of the number of cases that the healthcare system can adequately handle at one time, if we don't do anything, if we keep going out, if we have symptoms and we keep going out and we don't get tested, if you have symptoms and you leave the house and you don't stay home and practice self-quarantine, we will overrun the healthcare system like it has in Wuhan and like it has in Italy and now in New York, unfortunately, and Seattle and in California as well too. But if we practice protective measures, we can ride this thing out. It won't be a tsunami. It'll be small waves that hit us every time, but we'll be able to bounce back. So just cannot emphasize that anymore. If you have symptoms, I know there's a lot of debate about herbal stuff and homeopathic regimens. I'm more than happy to talk about that. But as of right now, there is no treatment. The antibiotics that are talked about and the antimalarials and the antiviral medications, we don't have trials, which is our best way of figuring out what are the best treatments, what are the side effects, how effective are they. We don't have that yet. So anybody who tells you there's a sure shot treatment, unfortunately, those are not the facts right now. So please keep yourself safe and keep your family safe too and your communities with this information. So So jumping gears, what the heck does this have to do with climate change? This was the topic about it as well. So I want to give a shout out to Colin Christopher over at C2C Consulting, who helped me with this slide and this graphic from Climate Action Tracker. So as you can see, climate change has its own curve. So we saw the one with flattening the curve for coronavirus, but there's also a climate change curve, and we really, really need to flatten that too. So as you can see on the left-hand side, historically is where we've been. So just tracking from 1990 to about 2010. So that black line where it ends right there is kind of present day. If we keep going kind of where we're at, not doing anything, just current policies, you can see the line here. I don't know if my marker will work or not, but this current potential trajectory is about up to max of 3.2 degrees Celsius. If the Earth continues to warm, despite all of that, you can get up to about in the 4 range of degrees of Celsius. For most, for people who are been staying in touch with this stuff, is that climate change, the UN Intergovernmental Panel on Climate Change has been meeting for the last several years, and the most recent recommendation was that we cannot go above 2 degrees. And so as of right now, you know, we're at 1.7 roughly. I hear things between 1.5 to 1.7. So you can see on the right-hand side all the different possibilities of what we do. If we do nothing, if we do optimal, you know, baseline optimal strategies, what people have played, what the current situation is. So we, as much as I'm talking about coronavirus right now, this really gets into climate change. And I think what the one, and this is not meant to sound demeaning or derogatory to people who are actively going through this crisis, but if there's a silver lining out of all of this pandemic, is that it is showing us a prequel to what climate change could do to us if we don't stop it right now. Before, before last week, you never thought you would have heard people talk about stimulus packages in the likes of $2 trillion or even $1 trillion that we can't hand out, you know, money to people. We can't do things like that. And because of how fast this pandemic grew and how quickly it affected people's lives and all of society, we were able to do it pretty quickly. Right, within a week or so. Well, obviously these conversations have been happening, but we were able to get the stimulus package passed. Regardless of the politics of it and all of that, we were able to get something done. So also, anytime people talk about, hey, we can't do stuff about climate change yet, we can't pass these things, we just proved that wrong, that we can make very wide sweeping, broad changes when we're pushed. But the thing is, do we want to be pushed all the time? Do we always want to be pushed when we're at 4 degrees Celsius or when we're at 2.8 degrees Celsius? Or is it something that we can do now, right? And so the other thing with it as well too is that the relationship between climate change and coronavirus is that they're both force multipliers. And I'm sure some people have probably heard that word before, but the Department of Defense actually gave that word in the last few years, is that climate change is a force multiplier, meaning that when you have something, it impacts not just one aspect of society, but several aspects of society. And we're seeing that with Corona. So I can move on to the next slide to show that part as well too. Well, actually I'll talk about it in just a second, but basically is that, so climate change, you know, people talk about how it's going to affect obviously the environment, humanity, health, economies, all of that. Coronavirus is doing all of that in the United States within 3 weeks, if not even a shorter amount of time than that, right? Probably within a week is when it started rearing its ugly head. So both of these situations and both of these issues have broad impact that don't just affect one aspect of society, which is why we're all in a crisis right now. And we will get over this crisis. We will get over the coronavirus. I don't know at what cost, but we will get over it as a society. But it doesn't mean that we don't have other problems still there, which is climate change at the end of all of this. So in the force multiplier aspect of it as well, and why healthcare is being, you might wonder that why is this such a problem? Like, why is it affecting healthcare so much? And if it's just affecting healthcare, why is it affecting the rest of society? And why should I care if it's just affecting, let's say, hospitals or doctors? So this is a layout, pretty complicated, of our current healthcare system in the United States. So it's also about financing, but it's also about just how we're structured. So you can see the CDC is over here on the left-hand side. So it's separate, it's under the Department of Health and Human Services. And so, but it is able to function somewhat independently. It is able to function outside of partisan issues. And then you obviously have your private insurance and all of that. So providers in the hospital system, which is where I represent that community, is right there kind of towards the bottom. That's everything that you can think of in terms of providers: pharmacies, docs, nursing homes, mental health, hospitals, all of that. So again, it's affecting, at least in this chart, it's affecting just one aspect, right? So it shouldn't all of us. But here's the reality, and this is where climate change and coronavirus also relate, is that this is the public health system in the United States, and this is from the CDC. So like I mentioned, that doctors being affected one. So I'm being affected, right? I don't have enough PPE, the hospital necessarily, but where are the other intersection points? So the hospitals, like I just mentioned, New York's getting better, Italy, China, like I mentioned, Seattle, California, all the hospital systems there. That was a lot of it about flattening the curve. EMS, we don't think about EMS a lot. You know, that they are literally frontline. I see people after they're admitted to the hospital, but these guys and ladies are going to people's homes and seeing things for the first hand. Mental health. This has caused there's an increase in suicide rates. There's an increase in suicide intentionality. There's an increase in calls to the National Suicide Hotline. People are scared. Kids are scared. Kids are not being able to go home. And when you talk about climate change, so this is all from the coronavirus, but when you talk about climate change, when the temperatures are going to get too hot to go outside, or if you have another pandemic, because pandemics are related to climate change as well. When you talk about, let's say, if storms, or you have multiple hurricanes like we did in a row, lives are going to change drastically, and they have, and that is going to substantially affect people's mental health. CHCs are community health centers. So we think about hospitals, but what about the actual clinics and the non-for-profit clinics and the charitable clinics? They are also getting affected. A lot of them are shut down because of the coronavirus, because they don't have enough protective equipment, and they just can't handle the caseload. And we don't have enough test kits right now either. So people's access to healthcare is being impacted. Nursing homes. That's where there was a huge breakout in Seattle when it first happened in the States. Those are still elderly folks that are the most at risk for this virus are being affected. I believe that was the last one. And then home health as well too. So we don't think about as well, a lot of people, you know, who can't take care of themselves usually have people that come to their home to help them out. And that is also being affected too, because who's at risk for contracting this illness as well. So you can see that it's not just one aspect of the healthcare system, it's multiple aspects of all of society that is being affected by coronavirus, and that can also be affected, not can, but will also be affected by climate change. So the healthcare system, I think I know I'm over time in just a little bit, but I'll try to wrap this up kind of quickly, is that the healthcare system is kind of like the Wizard of Oz, in my opinion, is the best I could describe it for people, is that we have had this notion that our healthcare system is the greatest, that we put the most money into it, so it's got to be the best, and it's this wonderful, amazing thing. And then in just 3 short weeks, we've realized how vulnerable it is, and how vulnerable people are, and how vulnerable we are on supply chains, and for things to go right. And you just realize that at the end of it, it's, you know, it isn't as strong as what we thought it was. So again, I know with time wise as well, but A lot of people who are familiar with this topic, they know about the impact of climate change on human health. I could go into this, you know, a lot, but this is a great image from the CDC that come up with. So I think just the biggest points right here is, let's say from the healthcare standpoint, from my point of view, asthma, cardiovascular disease. So air pollution is a big thing, right? When you think about LA or Beijing, let's say, a lot of people were wearing masks and a lot of air pollution issues. There are studies that are showing that that's just going to get worse. The more fossil fuels we emit, the more industry that uses fossil fuels, rates of asthma are going to increase, rates of heat. So as the temperature increases, heat stroke is going to become more and more of an issue. In Karachi in Pakistan, where my family is from, they actually, one of the businesses that was booming last year was the coffin making industry. So actual coffins for people for funerals, because so many people were dying that this gentleman's business, he was the only one making coffins at the time. So yeah, you talk about infectious diseases, right? So let's just talk about those three main issues. Obviously, you know, different vectors. So we think about vectors as, that's the word, right, the scientists use about what helps transmit diseases. So mosquitoes are the biggest known vector that we know about, malaria, about Zika, all of that. But as this coronavirus showed us too, is that where it actually came out was an exotic food market in Wuhan, and they too much animal human overcrowding, and a virus, and viruses are a natural part of nature. It's just that they don't all become pandemics or cause problems. And it went from an animal to a human host because of overcrowding. And so now we're dealing with a pandemic. So this is not the first pandemic, nor is it going to be the last. And climate change has been happening, and it's just only going to continue. A really quick point that I think sometimes gets lost, and the Interfaith Public Health Network in New York also helped remind me to really drive this point home, is about when we think about vulnerable communities, you forget about them, right? We don't always think about them when we're talking about policy or funding. It goes back to this concept of environmental justice. So again, these similarities between coronavirus and climate change, low-income communities are getting the most affected. So when you think about Flint, let's say, right? So poor drinking conditions, drinking water conditions, that wasn't necessarily a direct result of climate change. That was more a policy issue with their local government. But as you get more flooding of more pollution of local rivers, again, by companies and fossil fuel companies and other industries, as you get air pollution, water pollution, low-income communities that are overcrowded, that are where there's a lot more pollution rates, they're going to start getting more affected. And that's what and the concern is that you see in indigenous communities, and you know, and I apologize, I forgot to put in here very important rural communities as well too. So rural communities, indigenous, and whatever your politics are, immigrant detention camps, refugees, the Uyghurs in southern China, the Gaza Strip, again, regardless of your politics, Syrian refugee camps, all of these places are overcrowded. And so if a coronavirus case hits there, it affects everyone. And especially when you talk about these communities, so vulnerable, meaning they don't have a lot of financial access. They don't have test kits. If you do have a test kit and you test positive, do you have access to the medication? Do you have access to a doctor? And this virus affects young and old. There were case reports of kids getting this virus, obviously the elderly as well, and middle-aged people too. And all of those demographics affect these vulnerable communities. So I think if there's, and then to drive the point home, actually, let me just go back real quick to that one part. So to drive this point home is that I think the other silver lining of this epidemic as well too, and that hopefully can open people's eyes about climate change, is that, again, like I mentioned, is that you lose people in the process. You lose the fact that we're all human and that we're all part of this greater collective humanity. So bringing it back to humanity, that 40-year-old physician I was telling you about, he's still in the ICU, the last I checked, late yesterday, is that he's still intubated because of the virus. That 61-year-old nurse, she passed away. The 36-year-old school principal passed away, and a 36-year-old firefighter still remains in quarantine. He's tested positive and he can't work now because he has to self-quarantine. So this is real life. So, and then just trying to wrap it up somewhat quickly for you guys so that you can ask questions, is that, so what can faith communities do? And I feel like this, this quote is, I thought was very fitting in the sense that whenever there's a certain something that's affecting society, whatever it is, whether it's existential or whether it's real, like coronavirus and climate change, it can induce a lot of fear. It can induce the best of humanity, and it can induce the worst of humanity. And I think what faith communities can do in particular is remind us is that what does this all relate back to, right? And if it relates back to our humanity and us being creations of God, right? Is that that's what it ultimately comes back down to, is that if we have trust, right, in a higher power, but we also use the brain that that higher power gave us, we can overcome fears. We can overcome things before. The 1918 flu happened, the plague happened, SARS that happened, all these things that happened come through. And it's just a matter of, are we going to learn from those past mistakes and use our faith in a productive, scientific manner too. Just some real quick things that people can do. Please stay home and wash your hands if you go outside. Unlike I agree with what Alora said, going outside is very important, but just when you are, practice physical distancing, and then when you come home, wash your hands to do that. A lot of faith communities are feeling the brunt of this virus because they have had to either close shop, right, or close things down, suspend congregational prayer, and that's affecting them. So definitely reach out to them, help your local community. There are a lot of vulnerable people out there that we just don't know about, like I talked about earlier, and so just reaching out to help. If there is something a little more tangible, start the social media trend about flattening the curve, get me PPE for healthcare professionals, and flatten the climate curve. I think we really need to get that conversation started, because if we can make wide sweeping changes to policy now because of a crisis, we can continue to do that for the impending crisis of climate change that just awaits us, that is just awaiting us once this epidemic is over. If you have masks or other equipment that you know about people, I think we should be able to share these slides. So there's a really good donation site that people can go to, either to donate or to get masks as well too. So please spread that information. And the last thing is just reflecting and educating, right? I think I came across something on Facebook that, sorry, it wasn't Facebook, but so again, being Muslim, somebody had sent out, examples of when people had to be in isolation. And in our tradition, the Prophet Muhammad got the revelation from the angel and from God while he was in isolation. Not from a pandemic, but he was alone and in the cave, and he was thinking, and the revelation came to him. For the trans-Abrahamic people as well too, is that the prophet Jonah was in a whale when he received his enlightenment about God, and he was completely isolated from everyone. So isolation is not a bad thing. I think it'll help us reconnect with what really matters. Again, the humanity aspect of it, the doctors that are putting their lives on the line when they didn't sign up for that, the frontline workers, the grocery store workers, postal service, the people you don't really think about that are being effective and are the real heroes of this story. And then just educating yourself and then the people around you. The best, you as a faith community, as people who are loved by other people, you are trusted, right? You are engaged leaders in our community, and you can really impact people. That science and faith do not have to be different, that they're part of the same puzzle piece we're trying to figure out as humans. And that I believe in God wholeheartedly. Whatever outcome is supposed to happen is supposed to happen, but he gave us a brain for a reason. And I think that scientific law is just something that he's created too. This is my personal opinion. This isn't the facts I'm talking about now, but I think that they work hand in hand, and we shouldn't be afraid of facts. And we just need both in these uncertain times, because I'll be honest, I don't know how this is going to go. I think it will ultimately end, but like I said, at what cost? And it really depends on us. What cost are we willing to sacrifice and do for this? So with that, I'll stop right there and leave you with just a couple quotes. But again, I apologize for going over, Andrew, but thank you so much for this opportunity to speak, and I'm more than happy to answer any questions.
You bet. Thanks, Marium. So yeah, if you have questions for Marium, please put them into the chat. Either Laura or I will get to it. to what you have to say. I guess, Mariam, do you think, and this is something that was asked to me leading up to it, in terms of faith communities and these faith leaders, is it beneficial for them to try to, like in terms of supplies, you mentioned like face masks or anything, like what are things that a faith community could gather together and maybe donate, or is that idea even counterproductive?
Well, that's a great question, and I really appreciate people's willingness to want to help. And you know that it comes from such a genuine, true place. The thing, again, the scientific part about it, the aspect of it, is that good intentions don't always have the best outcomes all the time. And so the concern is that with making homemade masks is that it depends on the material that you use. And maybe I can share this later so you guys can see what are the actual materials that we would need. Because the people actually tested this during the flu, so some of the past flu epidemics that we've had. And that unfortunately there's a concern that you can actually hold on to those virus particles in the droplets in the air, and you could actually be exposing yourself more depending on the cloth type. So I think if you want to make masks for people, I think it's a great idea. Just please, and again, I'll share that article, but please use the right material and not just random material that looks pretty or that is looks nice or something, because that will help people out the most. But if you know of places that either like hardware stores, construction companies, things like that might have masks, the legitimate N95 masks, that would be really more helpful.
Got a question from Peter, and I'll just read it real quick. In our faith community, we've been advocating for universal health coverage. This has been talked about for a lot in the context of the pandemic. What are your thoughts on that, Mariam? What role do you see for the faith communities in terms of advocacy and trying to get healthcare for all?
Sure, that's a great question. Yeah, a lot of it's come up. So I know that for the purposes of all of these organizations are C3, so I just want to be mindful of that, and I'll certainly speak to it. Whatever I say now, it's not representative of Imana or the Ohio State University, so I just want to make that clear. So this is more just my personal take on it, and again, I don't want to infringe upon the C3 aspect of both of the groups, but it's one of those things where it's becoming a lot more, it's making a lot more sense. This idea of universal healthcare coverage is what I'll say about it. How we exactly do it, that I think is what the debate is going to come down to. But I think when you talk about universal healthcare coverage, does it mean having one single payer? Does it mean having no insurance and everything's through the employer, and that there's a one insurer of everyone? So some of those specifics I think we'll need to hash out. But I think whatever we do come up with, this universal health, is that I think it needs to be about people, right? And not about profit, insurance company profit, CEO profit, pharmaceutical company profit. It has to be about humans, and bringing it back to that. And I think this is what we've shown, is that because our healthcare system, again, this is my personal belief, is that it does not focus on the person, right? It has become a business. It's become where a patient is a consumer and they're buyers, right? And so we are profiting off of people's disease. So we're more of a disease care system versus a healthcare system. So I hope that answers your question. So I think it's extremely important that we need to start thinking about everybody. And universal also means not just humans, but animal health too. This coronavirus is a direct example of not focusing on animal health either. And so putting everything in context, even environmental health, that if you have a terrible air, but you have great universal health coverage, is that really going to help you ultimately, right? So I think in that context, so that answers your question, Peter.
Yeah, no, that's helpful. I want to move into the next question. I think there's this real issue of the problem of science and faith, and then kind of the demagoguing in general of faith-based communities and activists from non-faith folks. How do you think about bridging the gap between faith and non-faith and helping dismiss some of those stereotypes about the faith community and their kind of efforts to demean science?
Yeah, no, it's a great question. And that's why I threw it in there too, because I can't say that I have a great answer, but I think and when I mean a great answer in the sense that this has been going on for so long that it's not like there's one simple answer is what I mean. People back in the day used to be, crucified and poisoned because they had beliefs that were against the predominating religion at the time, right? Because it was a power dynamic. And I think that that's the problem is that because there were such power dynamics in the past, that science and religion and faith institutions made mistakes, right? And so that has perpetuated throughout history. And the only thing, like for example, the U.S. Public Health Service is great, right? They're the ones who are responding to this coronavirus issue in the States. But a lot of communities only relate them to the Tuskegee experiment. That only affected African American males and gave them syphilis, right? So it's what minority communities and individuals feel a lot is that one mistake and now they're branded for the rest of their life, and the entire community is branded for the rest of their life, even though it was individual mistakes. So I think a lot of it comes down to just educating people and acknowledging the past. And acknowledging that when people died because they found scientific explanations, but the faith institutions did not want their power to be compromised, I think we need to acknowledge that and say that that was wrong, but that was wrong, and we've moved and we're moving past it. That we have people who are devout people of faith, but who are also incredible scientists. And that because a lot of the people, and I think that, so that's one point, is acknowledging the past so that we can move on. And I think the second point is to recognize that a lot of faith prominent people of faith in our past were the scientists that found a lot of discoveries. Especially in the Muslim tradition as well too, a lot of religious people were the ones that figured out astronomy, figuring out navigation. When we so another example is Tycho Brahe back in the day, and so he I'm gonna now blank on the exact thing that he had figured out, whether that was related to orbit or things like that, and he got thrown in a dungeon afterwards. He was part of a church group, I believe, prior to, or it was either a friar or a monk or something like that, and so or priesthood, sorry. So there are those examples. So I think we just need to educate people. That I think people are just uneducated and they have a bad taste in their mouth from history. And so when you actually read into it, there is that complementary fashion. I hope that helps answer your question.
So Marium, we got a lot of questions that came in. We're going to try to get to everybody's questions. We have about a little under 15 minutes. So if we don't get your question, we can see if Marium's able to answer it, type it out, and we could send it forward so you could have an answer versus leaving you on the cliffhanger. So, because we could be here till tomorrow, but we know it's a lot. Everyone has things to do today. So we have a question of how can we effectively draw the comparisons between health impacts and societal changes will we expect to see from climate change and what's happening in the corona crisis without seeming insensitive or tone deaf to real impacts that people are suffering. As faith leaders, how do we communicate these difficult truths while still offering a vision of hope?
Yeah, that's a really great question. So I think like what we were talking about is that I think one way to do it is to show that coronavirus is and again, my friend Colin Christopher said this best, that coronavirus is the prequel to the climate change crisis or the climate crisis. And so it's not to say that one is worse than the other or that we should worry about one more than the other, but that once we're done with coronavirus, again, which we will be, what the cost is going to be, I don't know, but we will be done with it. At that point, we still have the climate change crisis to worry about. And so I think just connecting that they're more a temporal relationship, that one is right now, one is later. Not that obviously we need to address both at the same time, but I think just showing that connection to people, that once we're done with this, then what do we do? So we need to help focus on things right now. And then one thing that might not be, that I think won't be insensitive or tone deaf, is showing the relationships, this intergenerational relationship to this crisis. And again, props to Colin for having this concept, is that so right now, the youth, right, the ones who are not as high risk as the elderly, they're being called upon to enact or to do this communal duty of staying home so that their grandparents and other elderly people in society don't get sick. I think that what we could also do at the same time is educate maybe the elderly population as well too, that if the youth are doing this for you during this coronavirus, then maybe you can help them during the climate crisis or for the fight in this climate crisis, because your actions of pushing congressional officials, of funding certain organizations that focus on the climate crisis, that you can help ensure that the youth will have a life and an earth that they can, enjoy for their kids and future generations. So maybe tapping into how they're both connected, but just temporarily, that we're going to have to deal with one after another. And then the intergenerational concept, I think, won't come across as sensitive, that one aspect of society is working hard, maybe the others can do as well. And that, I think, is the hope, hopefully. Hopefully that answers your question, Leanne.
One thing I like that you touched upon was how this virus is affecting vulnerable communities who are already dealing with a lot of environmental justice issues at hand, as well as climate change issues. I guess my thing is, do you have any suggestions how we in different places around the U.S., I know we have a number of people who are from around the U.S. in this room, how can we be advocates for the people in those communities who are really going to suffer the brunt of course, climate change and environmental justice, but the coronavirus, because they don't have access to a lot of hospitals, not a lot of clinics. If there are tests, can they get the prescriptions? If they don't have health care. We recently saw, I would say we, but the governor of Mississippi has said there's no need to shut down the state. We're going to be fine. And, Mississippi is a state where, the average income is not high. And those people are automatically going to be hit very hard by having little to no supplies, but also by this hitting them as well. So do you have suggestions for how any of us in the group can advocate for those people there? Because I live in a city where there's testing about 10 minutes from my house, but I'm pretty sure they don't have the same option.
Yeah, no, that's a great point. And I think maybe what it comes down to is that the reason we have quote unquote vulnerable communities and populations is because I think our society has just been structured that way, right? Is that we've allowed these differences to happen. If you think about it, that person in Mississippi and you and me, there is no difference between us ultimately, right? And let's bring it back to faith. In the eyes of God, there's really nothing different between us except maybe our actions, right? And so this whole concept of having different communities, I think that's just all contrived, and it's something that humans have done. So if we've done that to make categories of society and this vulnerability, then we can undo it as well too. And so I think it kind of goes back to that other question about universal health, is that we can't just always make things partisan and trying to have one party win more than the other, and stop this thing of dividing people into it's your side and it's my side. This thing is affecting all of us, right? And so I think it's one of those things where you can reach out to those communities. You don't have to reach out to all of them because it's a very hard process to do, but like I was saying, as the things to do, that when you go into your communities, maybe if the homeless population, right, that you can work with a group that focuses on the homeless, or you can work with a group that focuses on civil voting rights, right? So they're connected with a lot of disenfranchised people in our community, and so you can figure out ways to help those connections. That's more of a long-term thing, I think, is breaking down this false idea that we are different somehow because of our economic abilities, but that we're not different at all. And that, and then I think just reaching out to those different groups, going outside of your comfort zone and participating. And I think the last thing, and this is not partisan, I think the last thing is to get civically engaged and to do your civic duty. Is that the reason a lot of things have happened is because laws and bills laws have been passed that have allowed this to happen. And all, this is not meant to point the finger, but a lot of, half of the population did not vote in the last election, in the last few elections, actually. And so we really need to step out of that and just start first with recognizing that we have a considerable part to play in this society. And what the coronavirus has showed us is that why it's important to do that is because I don't think in my lifetime, at least, that it's been this apparent that my individual actions, what impact that has on all of you. That me going out and coughing can literally kill someone if I have the coronavirus, right? And so I think it just comes back to that point too, is that you may think you can't do anything as one person, but this virus has showed you very well can have a great impact as one person. So go out and reach out to those people and break down those silos that we falsely created, I think.
Okay, Marium, do you have time for one more question? I don't want to hold you up.
Oh no, I got a lot of time actually. I just apologize that I can't get to all of these questions. I'm trying to read through them and answer some different parts of each of them.
This is one last question. I'm sorry to anybody who we couldn't get to. You all came up with a number of questions and fact sheets and things, which is absolutely fantabulous. But this one's really good. We're having a national conversation about whether or not losing human lives to have economic growth in this time of coronavirus, and many seem to think it's not. Do you think we can have the same conversation about toxic pollution from fossil fuels in a new way now? From a public health standpoint, is the data on disease from fossil fuel pollution around even before it impacts reliable and easily communicated? And what did it do? Oh no, it cut me out. Sorry. That was weird.
Okay.
It cut me off. So yeah, I guess, from a public health standpoint, is the data on disease from fossil fuel pollution on the ground reliable and easily communicated? And what are the faith implications of the fact in the case of toxic pollution, the population affected is not as broad as, not as broad as a swath of communities affected by coronavirus. So I guess that's what you're trying to convey, as we weigh economic growth and and this disease hitting the country, can we use that same model of yes, the disease is killing people, we have to think about economic growth and putting money into the government, but fossil fuels and dirty water and all those things they probably have killed more over the last 5 years than anything. How do we, I guess, convey that message and get that out to people?
Yeah, no, that's a great point too. So I agree. I think that you can use those same relationships, or you can use that same analogy for it. I think it's kind of what it's coming down to is what it seems like and what has happened with the fossil fuel industry, because they've even, there are reports now that that they did this, is that profits came before people. And I think, just looking through the other questions and points too, is that I think that's kind of what this comes down to. And when it comes down to faith, is that are we putting people and our duty to God before the worldly issues and before material wealth? And that's really what all of this breaks down to. So I know in the beginning of the talk, I said it really comes down to humanity. It's not bad to want wealth, right? Because as we see now, I have some economic mobility, so I can survive if I don't work, let's say. A lot of people don't. So having money is not bad. It's at what expense is that, right? And so what this epidemic is showing us too is that some people are still saying that, putting the economy above actual human life is okay because we need the economy to run. To a certain extent, I agree with that, because the economy actually funds people, right? It funds jobs that people work for and then get money. So it makes sense at a certain point that we need to think about the economy, but I think we can find a sweet spot between it where the economy works for us and not the other way around, right? Where we're not just working for Wall Street. Because when you bail out, and again, trying to make sure I stay within a nonpartisan lane, is that when you bail out certain industries and you don't think about the person working for those industries, that's the problem, I think. And that doesn't make you a socialist or anti-capitalist or anything. I think that's just what this virus is showing us. And this is why we have such a big problem, is because we've been doing that, worrying about how to make economic profits and not the actual workers. So, and I think what shows the best example that it can work and it has worked is with divestment from fossil fuels. Is that when you actually look at a lot of financial investment companies, it's not profitable to invest in coal anymore, specifically coal. Fracking is still not there yet, but at least when it comes to coal, it's not profitable. So people are actually going away from that. You know, there's a major investment company in the last few months that it said that they were going to divest from all coal, and I believe fossil fuel as well, because I think what people are recognizing is that the market is shifted too. So it's, you know, there's a lot of good news and a lot of hope on the front. I think it's just a matter of if all of us as individuals are going to start working collectively together to educate one another, to like advocate for it and push our congressional officials to work for us to pass the bills that we want, is that the curve is already shifting, or the trend is already shifting when it comes to climate change about investment portfolios. So I think you can latch onto that concept and then use that to help propel the conversation about, well, we need to also get rid of disparities, because when people are sick, there's a huge economic loss from people not working. And then that's going to end up hurting the economy too. So I think a big thing, so to summarize, the economy is not a bad thing, but it needs to work for us. And the climate change movement has already proven that with divesting from fossil fuels. So I think we just need to latch on to that aspect of it.
Yeah.
So thank you all for coming. We're going to have to cut it because we're definitely over time. Please receive all this well, and continue to stay safe. Of course, you know, social isolation, washing your hands, but also turn the news off if it's upsetting you. Stop reading articles that are upsetting. Maybe go outside for a walk within distance. Put on your favorite music, but something to not overcloud your mind with what's going on, because the more you think about it, the more it's going to drive you crazy. Also, Andrew and I are, of course, during this time of social isolation, we're all at home. We're not doing, I won't say we're not doing too much. We might have a little more free time. We're definitely open to more webinar ideas, more people you'd like to see speak on webinars, some topics to cover. So our emails are our email addresses are in the original email, and there'll be a follow-up one. Please reach out to us with any ideas you have, things you want to cover. When you want to do this again, we try to do them quarterly, but since we have a little more time now, we can maybe do one a little sooner. We're definitely open to all your opinions and your feedback on today, anything else you want to see in the future, so we can cater to you all and make it worth your while and enjoyable. And please, big thanks to Marium for coming and giving us part of her time and making this in-depth presentation. I mean, I learned a whole bunch, and it helped me out because so many news sources don't tell me the truth. I won't say that the truth, but it's confusing to see so many articles and diagrams. Yeah. It's much easier for me to understand about the curve and everything like that.
No, thank you. I really thank you so much. Thank you to Nick DePalma, to Colin, to you, Andrew, and Alora. Thank you guys so much, and everybody for paying attention. Really appreciate it.
Andrew?
No, just to echo everything. Thanks for being here today. Please stay safe. I saw a comment come up. I'm not sure. I think it was the Edge Network. You know, physically isolate, but don't socially isolate. Find ways to feed your souls in your communities right now. Reach out to folks who you know are struggling. Reach out to people you haven't talked to in a while. There's a lot of loneliness right now. And as a community and as people of faith, it's important to remember the poor and the outcast and those who don't have the same opportunities as others may. So thank you again. Thanks for this time. Be well, and we'll be in touch. All right. Bye, y'all.